All right, welcome in. My name is Michael Tharp. I'm here with Ricardo Hamilton and Todd Palm. We have decided to change our lives and join an amazing company called 7K Metals. And I love it, and I got involved because of the gold and silver delivered to my door, the ability to make residual income. But there's even more to what 7K offers. And we're going to hear from Todd today, who's going to share us some details. First of all, let me introduce Ricardo Hamilton. We have helped over 4,000 people join this business and start saving in real assets. So Ricardo, maybe you want to give people a quick summary of just how amazing 7K is, and then we'll get into what Todd has for us today.
Yeah, definitely, Mike. Man, it's just phenomenal when you have a membership with so much value in it, and one of the main things, when we looked at this was obviously being able to secure our financial future in assets like gold and silver and create a residual passive income and legacy and build a business. But this membership, like you mentioned, Mike, is just so dynamic that it also has a phenomenal healthcare program. And so I'm excited, to be able to be a part of this and share this with folks, especially in the times that we're in where people need quality healthcare, quality coverage. And for us to be able to offer this to people, it's truly amazing with this membership. The value is phenomenal. So yeah, I'm very excited to get into this information for the folks.
And I mean, I'm focused on gold and silver. And, I knew they had a healthcare plan, and I just didn't have the knowledge, the history, their experience to break it down until Todd Palm joined our team a few months ago. And he has a background in this industry, and he went through, he understands it. He's now using it and loving it and saving lots of money and getting paid more money. So Todd, welcome. Thank you for joining us today. And feel free to go ahead and tell us your story and share with us some of the details of this amazing plan, which is just another benefit that 7K Metals offers to their members.
Thanks, Mike. I'll be happy to share. So I'm going to share my screen and I'll show you the presentation that I put together. And like Mike said, this is the 7K health plan, and it's a benefit that you get when you join 7K Metals. It's one of the 10 benefits that we get. So my name's Todd Palm, and I have been in healthcare information technology for over 30 years. And I've been self-employed as a healthcare systems consultant since 2009. I've worked for 4 different health plans, and I help them implement the Patient Protection and Affordable Care Act. That's what you otherwise know as Obamacare. And in the industry, it's known as PPACA. And I've implemented benefits and pricing. So when you go to the doctor and they submit the claim to the health plan, I make sure that that claim pays exactly like it should. All accumulators accumulate the way they are supposed to. You get the benefit payment exactly like it is, because under the Affordable Care Act, members are not liable for anything. All the payment goes to the doctors. And along the way, I've implemented HIPAA, Sarbanes-Oxley, which you might not have heard of. That was a financial law that came out after Enron with accounting. So it made sure this law actually has some penalties in it where if you are cooking the books, there is jail time associated with it, federal jail time associated with this law. So I helped health plans implement their financial reporting from the healthcare information to do that. And remember back in 1999, Y2K was a big issue. I actually changed computer systems at the health plan to go from 2-digit years to 4-digit years to do that. I implemented recently ICD-10. That's the International Classification of Diseases, version 10. That's the list of diagnosis codes. It went from about 20,000 diagnosis codes to over 160,000 different diagnosis codes. The government kept delaying it. I was working with a health plan at the time, and we just simply implemented it and said, okay, we'll be in place before the government's ready. So when the government's finally ready, they were there. I've also implemented Medicare Part C and the Medicare Diabetes Prevention Program configuration. So you can see I've done a little bit of everything as far as it's related to healthcare, and I have experience in both commercial plans Medicaid plans, and Medicare plans. Now, the 7K health plan, it's available to anyone who joins 7K Metals. There's no qualifications to join. You don't have to reach a certain rank or have a certain amount of volume. And it's a viable alternative to the PPACA plans available on healthcare.gov. And it meets and exceeds the minimum essential coverage guidelines under that law. It's ERISA compliant. That's the Employee Retiree Income Security Act of 1975. Every health plan must be ERISA compliant. And it's administered by free market administrators. So 7K Metals is the company, but this is not 7K's health plan. They're partnered with free market administrators, and they're the third-party administrator. Some of the highlights: you get prescription drug coverage by the pharmacy benefit manager. That's ServU RX. You're only on the hook for up to $500 in a month for any one drug. It uses the...
Just so I'm clear then, so if anyone has prescriptions, once it hits 500, then basically they're paying for it.
Exactly.
Okay.
The nationwide provider network is PHCS. That is the biggest provider network in the country. There's a good chance that your doctor is in network. There are no pre-existing condition exclusions. So there's no deductibles. That's a big one. I know people that are paying...
What? No deductibles?
No deductibles. People are paying, like under the Affordable Care Act, those plans have deductibles that range between $9,000 and $40,000.
Yeah, that's what I've always heard, is crazy high deductibles and people complaining about Obamacare and stuff. So that, wow. All right, keep tell me more, Todd.
Now, there are, however, annual maximum benefits. Now, this is where it differs from the Affordable Care Act plans. The Affordable Care Act plans are unlimited. There are annual maximum benefits here. That is what keeps the premium cost low. There are unlimited, however, in-network primary care doctor visits for just a $10 copay. $10 out of your pocket to go see your primary care doctor.
Wow.
If you go to an urgent care center, you pay a $25 copay. And if you go for your checkup where you have no prevailing symptoms and it's really true preventive care, that's all at no cost. There is also a dental and vision discount plan administered by Carrington. This really appealed to me because I was paying for healthcare, but I was paying VSP separately and dentalplans.com separately for dental. So this is all in this one plan at no additional cost. And this is also where it exceeds the Affordable Care Act plans. Dental and vision ends at age 18 under the Affordable Care Act. This is not age limited. There are 3 plans available: Plan A, B, and C. Plan A has an individual maximum benefit for the year of $10,000 and a family of $20,000. Plan B doubles that to 20 and 40, and Plan C adds on to Plan B, where you get an additional $25,000 of enhanced benefits for individual and $50,000 of enhanced benefits for family. And that enhanced benefit is for inpatient hospital, outpatient surgery, and professional services. Now, that might not seem like it's a lot of money. I saw a webinar that one of the principals of free market administrators was on, and they looked at all of their claim experience, and they said the average of all of their claims for a year, the average cost was $7,000. So not too bad.
Yeah, that's what I would guess too. You know, being a teacher for 15 years, you know, we had pretty good healthcare. This almost looks better, but I would say, you know, we had an HSA, and typically, you know, my family would spend between $4,000 and $8,000 in the average year. So that sounds about right.
Right, and you had the HSA because your plan probably had a high deductible, and the HSA was the government's way of letting you pay for that deductible and deduct that from your taxes.
Yep.
Now, the vision and dental is a discount plan. It's not actually insurance, but that's included at no additional cost, and it uses the Carrington point of service dental network. and there's a provider lookup tool there, so you can go and see if your provider is in network. And if your provider is not in network, they give you a way to nominate your provider so he'll join the network. The VSP benefit is the VSP Vision Savings Pass, and the LASIK Vision Network if you are a candidate for LASIK. That gives you $800 savings on custom LASIK through LASIK Plus, and you get free enhancements for life plus free exams.
Wow. I had LASIK done. It's amazing. Changed my life.
And now this is some of the savings under the dental plan. I managed to find this when I got when they sent me my membership packet so I could log on and actually see it. So typically, if you have dental insurance, that typically has a $1,000 or $2,000 limit, not including orthodontia.
Yep.
So you can exceed $2,000 in benefits with a dental savings plan. That's why a savings plan is a little bit better for dental.
And so just so I'm clear, you're telling me if you get any of these healthcare plans, the dental and vision savings is just free, comes with it.
It's free, it's included.
Wow, okay.
Now the vision part of it, if you go, VSP is one of the largest ones in the nation, and if you go to one of their physicians, just for an eye exam, it's a 20% discount on the eye exam. But if you go and get an eye exam and glasses, you pay a $50 flat fee for the eye exam. And you get 15% savings on contacts and special pricing on pairs of glasses and sunglasses. And the key here, it's unlimited use throughout the year. I was paying for VSP separately, and I could only use that benefit once every 12 months.
Yep, that's how almost every vision I've seen is too. So yeah, this is unbelievable.
Yeah, now this is only not available in Washington and Vermont.
Okay.
Now, here are some of the costs for the 7K healthcare plan. Now, if you are under an employer plan, you work for an employer and they're paying part of your premium, this may look a little expensive to you. But if you're self-employed, like I am, before the Affordable Care Act became law, it was the wild, wild west out there looking for self-employed insurance. It just didn't exist. There was no regulation. So this was really appealing to me. For the Plan A, there's a breakdown of 18 to 49 and 50 to 64. This is the monthly premium. In Plan B, you would think it would be doubled, right? Because it's a double annual benefit, but it's actually not. And Plan C, I'm in the 50 to 64 age group, and I picked the employee plus family. So it's me, my wife, and my youngest son. And $1,048 was less than half of what I was paying Anthem. So it was a no-brainer.
Yeah, and can you go back to Plan A, the last slide real quick?
Whoops.
So this is if you're an individual, right?
Mm-hmm.
So somebody under 50 years old can get the Plan A for 250. They can be covered for 254 a month.
Exactly.
With their insurance. Wow. And you can have your whole family for 561.
Yep.
Okay. And then, like you said, it doesn't double when you double what you can spend. 723. Yeah. So yeah, this is, I'm not super versed like you are, but this is way cheaper than anything I've ever seen really before or heard from anyone.
Right. And if you're trying to get insurance that's not part of the Affordable Care Act, there are no regulations, and I've seen things out there that border on the illegal.
Right. Yeah.
And this is the premiums for Plan C.
Okay.
Now, there's also catastrophic coverage. So if you think, okay, in my family, I've got one chronic person that may exceed that benefit limit, in plans A, B, and C.
Mm-hmm.
The catastrophic piece is the way to have your insurance against an unexpected diagnosis, right? And that's the answer to the low annual benefit plans. The member responsibility is the first $20,000. So if you get a $500,000 bill, you're only on the hook for the first 20,000 of that. But and there is a pre-existing clause. It says if you've been treated for a condition in the last 12 months, you have to wait 6 months before you can use the catastrophic plan. But what this allows you to do is to share either $150,000, $250,000, or $500,000 of your out-of-pocket cost annually. You can do this twice for a small monthly premium amount that you select when you sign up for the health plan. This is paid for by other members of the health sharing plan.
So is the first 20,000, could that come from your insurance?
That could come from your insurance.
Okay.
Yeah, but you're only on the hook for the first 20,000. You're on the hook for the first 20,000 of what you're going to share.
Gotcha. Okay.
Yeah. So this lays it out. The annual sharing, there's a lifetime maximum, which is basically double of what you share the first year, what you can share. And these are some of the premiums for the $150,000 one.
Okay, so you're looking between 100 and 150 for the catastrophic premium a month.
Yep.
Okay.
And then this is the 200. If you want to share up to $250,000 of out of pocket, this would be the premium. I picked this one for the 50 to 59, so it was $352, right? And remember, the health plan was $1,048. Mm-hmm. Together, it's $1,400 that I'm outlaying, which is almost a $900 savings over what I was paying before still.
Okay. So you're over 50, your entire family has the health insurance, the dental, the vision, and you got this catastrophic, and you're looking at about $1,400 a month for everything.
Yep. And you'll notice the last age band breakdown ends at 64. That's because at 65, you're eligible for Medicare.
Right.
So that's why there's no coverage for that age group one. And this is the premium for actually, this is not really a premium. It's a sharing amount. It's how, when you pay this, you're actually helping pay someone else who submitted a large bill like that.
Right.
But wait, there's more.
It gets better?
It gets better. You can offer the 7K health. You can offer this health plan to employers with 2 to 50 or 51 to 150 employees. But a license is required to offer the catastrophic plan. But you can refer them to the experts at SBA Co-op. And the quick link to show your new, if you have a new member and you want to show them the healthcare plan really quickly, you can go to 7khealth.com/your ID, your 7K username.
Oh, okay. Awesome.
And then a link to give employers is 7khealthgroup.com/your 7K username. But there's even more. Your qualifying health plans will generate points, and it goes into the binary, just like the metals do. Individual plans are 15 points a month. Family plans are 20 points a month. The medical plan, the health plan is one product. The catastrophic plan is another product that also generates 15 or 20 points, whether it's individual or family. So you can put as much as 40 points back into the binary plan just from the healthcare. Right.
And if those of you that are watching that are maybe just here for the health insurance, what Todd is talking about, how in 7K Metals, when our team or people or members in 7K purchase gold and silver, we get points that turn into dollars. So not only can we profit from helping people get silver and gold, now we can profit, and our whole team can profit when people are paying their healthcare premiums every month in 7K. So essentially it's paying dozens, maybe even hundreds of people, 15 or 20, or like Todd said, he just found this out, is you get it 15 or 20 for the healthcare plan. And then if they get the catastrophic, that's another 20. So, I mean, this is just unbelievable.
Right. And that was it.
Awesome. Well, I mean, I'm blown away. The value the service, the price, and the ease of use, and knowing that, you know, Todd's gone through this and is able to save over $900 a month. I can't wait to start telling more people about this. So Todd, that was awesome. Ricardo,
Yeah.
would love to get your take on what you heard and how it can help people.
Yeah, no, I mean, that's very exciting. You know, because we talk about offering real solutions, you know, for real people, you know, and adding value. And what I just saw, I see that the average person can take advantage of. You know, when we're talking about 200, you know, to 500, you know, a month, and you're getting some quality insurance and, you know, all the benefits that Todd went over. No, very exciting. I can't actually wait to actually go just talk to some employers just to try to get a better idea of what they're offering their people, and making sure that I share this out with the team, because you know, we do have a healthcare crisis, you know, and people need, you know, better ways. They need a solution. Not in addition to just their finances, like which we do, but also their health. You know, health and wealth go hand in hand. And I think that, you know, this is a phenomenal way for people to get access to some quality health insurance. Thank you, Todd, for doing that and sharing that information so eloquently and helping people understand the magnitude of this healthcare program. And that was awesome.
I appreciate that. And, you know, I joined on November 13th, and the Idaho regional event was the next day.
Mm-hmm.
And I saw that benefit wheel for the first time. And I saw we had healthcare. Because when I joined, I wasn't planning on building. I was in another business that I was really happy with.
Yeah.
And I was just going to collect coins. And when I saw that and what we could offer, that changed everything.
Yeah. Yeah, no, 7K is definitely put together a membership with value that is going to be here in the marketplace, change the marketplace, and there's definitely longevity here as well. So it's very exciting, very exciting.
Again, it's just the benefits this company offers. Like, you know, you would think I would have grasped this a few months ago, but it's like, as we just continue to learn more and more about this company, it just keeps getting better and better. And again, that's why I love that, you know, our team and this whole 7K family is we get to use our own individual strengths. You know, had Todd not come along with all his experience and background in healthcare, you know, we might have not found out about this. And now Ricardo and I can use this to help bring it to our team, to help bring it to more people, to help everybody win. And that's what, you know, we're about. And it's the motto of 7K is changing the world one family at a time. And now not only are we able to do this with physical gold and silver delivered to your door, we're able to do this with amazing healthcare that, from what I'm seeing and what Todd experienced, seems to beat almost anything you can find out, you know, on the marketplace right now. So that's all I had to say today. Todd, did you have any last insight or input, or you wanted to say anything before we take off?
I think I said enough today.
Awesome.
All right,
awesome.
well,
And
go ahead.
Yeah, I was just going to say, you know, definitely get back to whoever shared this video with you. More than likely, they're in position to help you, you know, leverage this awesome membership and the value of this healthcare program.
Yeah, without a doubt. That's what I was going to say is, you know, we'll put this up on social media. So it's probably, you know, you might watch this, someone from our team. So get back with them, you know, get their link, have them get in contact with someone else. And I'm sure we'll be doing some more stuff with Todd with all his knowledge and background in this. So that's all we have for you guys today. We'll talk to you guys soon. Peace.